Fitness is the order of the day. This is Go Island. I'm Ruth Harris. You're watching Go Island. We're on location in the town of Comox at the community center, the Comox Community Center, in the fitness room. And fitness is the order of the day. There is a brand new program starting here in January, and we are going to learn all about it from Sarah Wright and Dr. Sarah Sandwith. And we are also going to speak to one of the graduates of the pilot program, whose name is Emily, who's going to share her story. We have a fantastic show lined up. We're going to start right here in the Comox Valley. I'm Ruth Harris. You're watching Go Island on Shaw TV's Channel 4. We're on location in the town of Comox at the Comox Community Center, and we're going to be speaking with Sarah and Dr. Sandwith. And I only know that because she's wearing her tag. And we got Sarah and Sarah going on. So we're going to be talking. Why don't you explain why we're here today?
So we're really excited to be offering a cardiopulmonary wellness program to residents of the Comox Valley. So it's targeted towards people with chronic conditions, specifically heart and lung conditions. And it's a 12-week exercise program that includes education and group exercise all as a group as well. So it's really exciting to be offering to the public at this point. We've completed 2 pilot projects earlier in the year, and It's time to let it go.
So how do people know they can come here? Where does the recommendation come from?
So a physician referral is required to come into the program. And there is some testing that needs to have been done in the last year or 2. It's specific to, at this point, to people that have already had a heart event or have been struggling with a lung condition, and that's their barrier in getting more active. Okay,
so Dr. Sandwith, from a physician's point of view, how important is this program?
You know, I can't say enough how vital this kind of activity and structured exercise program is for people who've had heart attacks or COPD or any heart or lung condition. We know that exercise isn't just prevention, it's part of the cure. In my office, I have access to medications, and I can suggest that people start to get active, but I don't know that they know how to do that safely or effectively. Having access to a program like this is the standard of care, and up till now it hasn't been available in this community. So I'm so excited that the St. Joseph's Hospital Foundation and the Comox Recreation and Sarah have all come together to make this available for our patients, our neighbors, our friends in this community. It's going to keep them out of the hospital.
Yes.
It's going to improve their quality of life.
Okay.
And it's going to improve things like mood. It's going to have just far-reaching effects beyond what anybody could even imagine.
Okay. Now, we're going to head off to a story here up in Campbell River, but when we come back, we're going to talk about the day-to-day of what happens in the program and outside of the program. Have a look at this. We'll be right back. I'm Ruth Harris. Thanks so much for staying with us. We're on location in the Comox Valley, in the town of Comox, at the Comox Community Center, and we are speaking specifically with Sarah and Sarah, and they are here talking to us today about the cardiopulmonary exercise program. Okay, now, whose brainchild is this?
Barb Paulson and Craig Dixon have been working on getting a program like this going for, I think, 10 years.
Okay.
So they work in the hospital here in Comox. They've been trying, and all of a sudden everything has kind of come into alignment. Some funding became available from the St. Joseph's Hospital Foundation. And we were able to get it up and rolling.
Okay. Now, a patient comes into your office and they are struggling, but it's not necessarily a full diagnosis yet. What do you do next?
So seeing someone's family physician is going to be the first port of call, and we can help somebody identify not only what is the condition that we're working with, but also what other testing might need to happen so that you can safely be referred to the program. And that might involve doing some preliminary tests or even asking a specialist to do an exercise stress test. And after that's all in place, then we as a family physician will refer the patient through to the program to Sarah, and they will assess them and bring them in when it's appropriate.
Okay. And then when you have somebody come to your office and say, all right, I've been approved for the program, What's the next step for them? Do you sit down with them and make a plan?
Yes,
Is it
so we'll
8 weeks or 10 weeks or 12 weeks? How many weeks is it?
12 weeks.
12 weeks,
Yeah.
okay.
So we'll do an individual assessment on each client. As an exercise physiologist, I can take what a physician has diagnosed a client with
Okay.
and create an exercise prescription specific to them. So it's
Okay.
a group-based exercise program, but everyone gets an individualized program based on their needs and goals and their chronic condition.
And I know over our shoulder are Jill and Emily.
Yes.
And what are they working on?
So Emily is a graduate from the pilot project,
Okay.
and basically in the class we do a group warm-up together. We take blood pressure, heart rate, oxygen
Okay.
level prior to exercise, make sure everyone is safe to go, and then we'll go over and do cardiovascular exercise, balance and mobility, general strengthening, whatever is important for that client
Okay.
based on their condition and goals.
Okay. And Jill is your fitness expert.
Yeah, so
Okay.
Jill, there's two of us available to help clients with each session. So Jill is a BCRPA fitness leader, and she'll
Okay.
be facilitating the group as well.
Awesome. Okay. All right, we're going to take a short break, but we'll be right back. Don't go anywhere. I'm Mary Ruth Harris. You're watching Go Island on Shaw TV's Channel 4. Joining me are Sarah Wright and Dr. Sarah Sandwith. Not Sandwich, but Sandwith. And Sarah, what do you have to say to all the physicians and potential patients out there?
So if you're somebody with a chronic heart or lung condition and you're interested in taking charge of that condition and you would like to come to this program, speak to your family doctor about a referral. We'd love to see you here.
And
when is that happening? In January?
So we're aiming to start the program January 13th for 12 candidates. So it's a short timeline, but as soon as we have those 12 candidates that have gone through the test, have specific testing, are ready to go, we're ready to go.
And when does it run specifically?
Tuesday and Thursday afternoons.
And in this time, like mid-afternoon when it's quiet?
Yeah, it's nice and quiet in the gym
Okay.
facility, so it's more comfortable for clients.
All right. Well, thank you so much, both of you, for joining us today and filling us in on this amazing new program for the Comox Valley. Really terrific.
Thank you.
We are going to have a look at this. We'll be right back. I'm Mary Ruth Harris. You're watching Go Island on Shaw TV's Channel 4. We're at the Comox Community Center in the fitness room where all the fitness equipment is, and joining me are Emily and Jill. Now, Emily is a graduate of the pilot program that Sarah and Dr. Sandwith talked to us about earlier. What did you feel the benefit of the pilot program was for you?
Oh, it was absolutely enormous. I had not exercised really in a number of years prior to coming to this. So there was some fear involved, but also I didn't know how to use the machines. I really didn't know even where to begin. And now, my goodness, exercise is a daily part of my life, but it has been so wonderful for my health. My lungs are getting stronger, I'm stronger, able to do so much more.
Awesome.
There's no going back for me. I'm here to stay.
That's awesome. Now, Jill, what's your role?
My role is I'm going to be assisting Sarah with the cardiopulmonary program here at Comox Rec. And I'm also an employee here.
Okay.
So I'm the one that kind of knows all the equipment the best. And so when patients are referred, we'll assess them first and then bring them into the weight room here and carry out their exercise program.
Okay. And so I would guess that there's a lot of training around the equipment, because this looks really complicated. Like I'm intimidated. Like I haven't come because I'm intimidated by the equipment.
Right.
So
That would be my part. That would
Okay.
be my part, to make you not feel so intimidated,
Okay.
show you how all the equipment works, and
Awesome.
actually it's really quite easy.
okay.
Yeah.
All right. We're going to take a short break. We'll be right back. I'm Mary Ruth Harris. Welcome back to Go Island on Shaw TV. We are at the Comox Community Center in the fitness room, and joining me is Emily, who is a graduate of the pilot program for cardiovascular and pulmonary health. Now, one of the things, in addition to exercise, that you've mentioned
Yes.
is the importance of food.
Yes.
When did that come into play?
Oh, gracious. Let's see. As my health declined, I was tired. I didn't want to put the effort into shopping, into cooking, really into preparing things. So it slowly started getting worse and worse. Once we started to learn about food, about the fuel, about the energy, about everything that this was going to give your body,
Okay.
in order to bring it into a state where you do have the energy and the mental sharpness, an ability to really start looking forward and looking at that exercise and truly taking it on.
So
one
Sarah and
definitely,
Jill were helping you with the food, like the food aspect of it. Okay.
absolutely, yes, and portions.
And portions,
And
yes.
really what good choices were.
Oh, okay. So
So-
balance of vegetables and protein and carbs and how that all works. Okay.
Absolutely.
Okay.
Yes.
Great. So
been marvelous.
how do you feel now?
I feel 110%. I truly do.
Okay,
And
that's awesome.
it's just been such an opening.
Yeah.
Because really, it's been so many tools now in my tool belt. And I look at them and I reach for them on a daily basis.
Awesome.
So I've been able to live my life fully now.
Cool. Well,
Yeah.
thank you so much, Emily, and congratulations on your success. I hope you'll be inspired. I'm sure you'll be inspiring to a lot of people out there watching.
I hope so. Thank you.
All right, we are going to watch this story coming up, but stay tuned because we're coming back again. I'm Mary Ruth Harris. Thank you so much for watching Go Island on Shaw TV's Channel 4. We've had a wonderful time here at the Comox Community Center speaking with Sarah Wright and Dr. Sarah Sandwith and Emily and Jill. What an amazing, inspiring story. Great way to head into Christmas. So speaking of Christmas, there are events in every community every weekend up until Christmas. Please check your local calendars in Campbell River, Powell River, and the Comox Valley to find something that would work for you and your family. There is stuff going on at all the rec centers over Christmas, so keep that in mind. And right now, we're wishing you a very happy weekend. Lots of last minute Christmas stuff. Be dry, be safe, and we'll see you on Tuesday.